Hello, good morning. My name is Shadi Reyes. I am an interventional fellow at MidStar Washington Hospital Center. And with me is Dr. Richard Chazal. He is the current president of American College of Cardiology. Welcome, Dr. Chazal.
Thank you.
Today is Friday, and we are at the Leadership Forum. A great opportunity for fellows to attend and see what's new and coming in the business part of cardiology. What is the current vision of the ACC for fellows in terms of leadership, business in the coming 1 or 2 years?
Well, we think there's a huge opportunity for all of us, but especially for our younger members to become engaged in a rapidly evolving system. And this particular program, where it melds the leadership forum with what we call the Cardiovascular Summit, a unique meeting that talks about a lot of the business of medicine and some of the delivery systems that are going to become crucial to our ability to effectively deliver care to our patients. You know, your generation and your colleagues are extremely flexible in terms of being able to adapt to rapid change, more so than my generation, perhaps. And I think there's a great opportunity for you to engage and often lead some of the changes that are taking place. The other day in a keynote speech, Menno Walsh, who will be the president of the ACC after I, made a key point that it's no longer adequate for an expert clinician to be simply an expert clinician. We also have to begin to understand delivery methods, delivery policies, reimbursement policies, and all of the changes that are coming down the pike to be able to most effectively accomplish our job.
ACC has been a great leader for our education as fellows in cardiology, the COCAS 5 and everything. Do you see there is an urgency or there's importance of incorporating these, what we are learning today, into our curriculum during our training?
It's a great question, Shadi, and we're increasingly looking at opportunities and trying to figure out how much of this non-clinical information needs to be put in, and does it need to be formally, for example, in the form of COCATs, or more informally. This morning I had a meeting with Mike Valentine, who's the current vice president. He'll be the ACC president after Menno Walsh, and we were specifically addressing this issue. What about some of the non-clinical competencies that traditionally we were not taught, at least in my generation, and to some extent not in your generation, not taught as much in fellowship, but may become important to you to be successful leaders in healthcare? We feel very strongly, and I feel particularly strongly, that a really healthy care system needs to have physician engagement and care team engagement. So it could be nurses, pharmacists, nurse practitioners, physicians, and others to really get the input of those experts into the system. So learning these non-clinical skills, negotiating, how to run a meeting, what's some of the business aspects of medicine, and some of the regulatory issues and how to be able to deal with these it's a crucial skill set.
Well, this is great tips, great hints, and great vision for ACC for fellows. Thank you so much, Dr. Chazal, for your time. It was really a pleasure talking to you. And this is Fits on the Go. Please follow us on the on the YouTube channel.